If someone is first diagnosed with COPD and does not require oxygen, if they quit smoking, if they take away the causative agent, it should not get any worse and it should not progress.
COPD, or chronic obstructive pulmonary disease, is a lifelong condition, but it doesn't have to be a progressive one.
We patients need to have good adherence to our medication. We need to stay active. We're equal partners in care with our physicians.
So if you've recently been diagnosed with COPD or know someone who has and are wondering, what now? Welcome to this episode of the COPD podcast with me, Michaela Arneson. If you've jumped straight to this episode, we recommend you go back to the beginning and listen to them in order. In this episode, we'll learn how people with COPD can prevent their condition from getting worse, and what first-line treatments, medications, therapy, and other interventions are often prescribed after diagnosis.
We just have to find interventions that are helpful for each individual. It's not a one-size-fits-all answer.
Also, stay tuned to the end, and we'll share a list of resources where you can learn more. A quick note before we get started. This series is for educational purposes only. It is not a substitute for formal medical advice, diagnosis, or treatment. So if you have questions, talk to your qualified healthcare provider. In the previous episode, we talked about smoking, which is the biggest risk factor for COPD. So yeah, if you're a smoker with COPD, you're going to want to find a way to stop. But beyond smoking cessation, people with COPD can be prescribed medication to make their breathing easier and reduce the severity of their symptoms.
The first thing that you're probably going to try once you're diagnosed with COPD is some kind of inhaled medication.
Inhaled medication can be delivered in the form of an inhaler or a nebulizer, which sprays liquid medicine in a fine mist that you breathe in. One type of inhaled medication is called a bronchodilator.
All of your airways in your lungs have small muscles around them, and a bronchodilator helps those muscles relax a little bit better so that you can get better air movement in and out.
And there are different kinds of bronchodilators that work differently to ease breathing.
We have longer-acting medications that we sometimes call controllers or maintenance meds. These are things you take every day, no matter how you feel. Of course, sometimes you need those shorter-acting reliever, sometimes they're even called rescue medications.
Symptoms can suddenly become worse in what's known as an exacerbation or a flare-up. This is often due to external factors like a cold, bacterial infection, pollen, or air pollution. And that's where a short-acting or rescue inhaler will be used. They last between 4 and 6 hours, whereas long-lasting inhalers are good for between 12 and 24 hours.
The reliever you should have with you all the time because you can't always predict what your trigger is going to be, and you can't always predict where you're going to run into it.
But bronchodilators aren't the only kind of inhaled medication that can improve symptoms of COPD.
If that's not enough, we sometimes need to add additional inhalers that have inhaled steroids.
Meet Dr. Mina Persida.
I am an assistant professor in pulmonary and critical care medicine at the University of Michigan Medical School, and I practice here in Ann Arbor, Michigan. Now, the inhaled steroids are just going and staying inside the lung. That, again, reduces inflammation. It allows the airways to be more open and hopefully allow the patient to breathe easier.
Like smoking cessation, there is no one-size-fits-all answer when it comes to treatment. What works for one person might not work for another.
Deciding which inhaler to use really depends on the severity of the patient's symptoms, not only shortness of breath, but also cough and phlegm production, sleep quality, exercise limitation, and energy levels.
And many people with COPD will be prescribed more than one medication.
We usually use a combination strategy of these inhaled medications.
I manage with all of the prescribed medications by my pulmonologist: a long-acting bronchodilator, rescue inhaler, nebulizer.
Jan Cotton was diagnosed with COPD in 2000.
The nebulizer for me, I use every 6 hours. It looks like a pipe, and it keeps me opened up. Once I use that, I can breathe more easy, and it works with the medications that I take. The only thing about it is after a while, you kind of sort of lose your voice. You may hear a little hoarseness now, and that's why, because it makes your mouth so dry.
But what if someone is still experiencing flare-ups, at least twice a year? Dr. Persida says there are additional options.
So there are two medications that we generally use to reduce the number of flare-ups. One of them is meant for patients who make sputum and phlegm every day. They take an oral pill every day. The other medication is actually an antibiotic, but we use it for its anti-inflammatory effects, and that's generally taken as a pill 3 times a week.
We'll get more into flare-ups in a later episode. But for now, here's one last piece of advice from Mike about using whatever medicine you're prescribed.
Technique is incredibly important with these devices. If you take too little of your medication, you aren't going to get your best effect. And there are some relievers out there that work very similar to adrenaline. So if you take too much of it, you might get kind of jumpy, jittery.
Another important aspect of COPD management and treatment is something called pulmonary rehabilitation.
Pulmonary rehabilitation is a structured, monitored exercise program. You meet a respiratory therapist, sometimes a registered nurse, several times a week who guides you through exercises, keeping an eye on your oxygen level, heart rate, respiratory rate, so that you are safe and you're taught how to exercise appropriately for your level of breathlessness and other symptoms.
Pulmonary rehab programs also teach people about better nutrition. And importantly, it gives them a social support network.
I was afraid, but then I got there and found other people that were in the same condition as me. We became friends. It made you want to keep coming back. Not only that, it made you feel better, mentally, physically, the whole 9 yards. It made you say, I can really do this. You start slow, easy, and you gravitate up until you get where you want to be.
Another important aspect of a pulmonary rehab program is learning breathing techniques, which are important because people with COPD can easily become winded, even when doing small things. One such technique is called pursed lip breathing.
You take a breath in through your nose, you put your lips together like you're about to whistle, and then you blow out through them. That does a couple of things. First of all, it keeps your airways open longer to help flush out some of the stale air. It also gives you a chance to kind of recenter yourself mentally and come back down off some of that anxiety that is always a piece of being short of breath.
The formula is you want to breathe in for 2 seconds and out for 4. Pursed lip breathing isn't something that comes naturally to people. Practice pursed lip breathing when you don't need it, and then it becomes like second nature. When you do need it, it's there for you.
Stephanie also teaches diaphragmatic breathing, which trains people to breathe with their diaphragm, which is that little muscle underneath your ribs, rather than with the muscles in their chest.
It really is difficult for everyone. I mean, really, the only people in this world who breathe like they should are newborn babies and opera singers. When people are living with COPD, their diaphragm becomes flattened and it isn't able to expand and contract like it should. So that's where we ask people to relax, lean back, and put one hand on their chest and one hand just at the base of their ribs. That's where your diaphragm is. When they take a breath in, they want to see that hand that's on their diaphragm rise when they take a breath. When they exhale, we want to see that hand fall back down and return to its normal position. We don't want the hand on the chest to move.
Give it a try now. Relax and try to lean back. Place one hand on your chest and the other below it, just beneath your ribs. Now, as you breathe in, try to keep the top hand still and only move the bottom hand up and down by breathing through your diaphragm. Breathing with your diaphragm feels surprisingly unnatural at first, but practice can help. So, pulmonary rehab offers a lot of important tools and techniques to help people manage their COPD and lead a healthy life. But pulmonary rehab isn't always covered by insurance, and not everyone lives near a program.
Sadly, pulmonary rehabilitation is only available for probably 3% of people.
John Linnell was diagnosed with COPD in 2005, and he's experienced firsthand the differences in access to care across the United States.
Being diagnosed in the Phoenix metropolitan area, and then after many, many years moving back to rural Wisconsin, was certainly an eye-opener for me. There's a huge disparity with rural access to health care overall, But specifically for respiratory diseases, we need the same access.
So if you're someone who wants to take advantage of pulmonary rehab, but like John, you don't live near a program or you can't afford one, don't worry. Dr. Persida says there are options for you.
If it's a transportation issue, with the pandemic, telehealth and telemedicine has really expanded. There are pulmonary rehab programs that actually are video-based visits. But for those patients who can't access it for other reasons, online there is a wealth of resources on breathing techniques and specific exercises.
The COPD Foundation has a list of these techniques on their website. Plus, they run a nationwide program called Harmonicas for Health, which has helped people across the country practice their breathing and strengthen their respiratory muscles.
The harmonica playing mimics pursed lip breathing. So they're getting the benefits of pursed lip breathing while they're having fun, doing something kind of creative and making music. And honestly, if you can read numbers and arrows up and down, you can play harmonica.
And if you want to learn more about exercise, what you're taught in pulmonary rehab isn't actually much different from the basic fitness advice all of us should follow.
Part of the focus is on strength training, and then part of it is on aerobic training. So on the aerobic side, it's similar to what people do when they go to exercise at a gym. They're walking or they're biking or doing hand pedaling. And from a strength perspective, a lot of it has to do with upper body strength and using small free weights because the muscles that help you breathe are all in your upper body.
Of course, you should always talk to your qualified healthcare provider about exercise, like any aspect of your COPD management, to make sure you're being safe and using good techniques. Now let's talk about some other resources. As always, visit our website at healthunmuted.com/resources for an updated list of websites, programs, and more. If you want more information about medications for COPD, check out the COPD Foundation, WebMD, and Healthline. And if you're having trouble accessing the medication you need, consider patient or pharmaceutical assistance programs.
I discovered patient assistance programs through pharma companies.
Many pharmaceutical companies offer their medications to qualifying patients at little or no cost. And there are also local programs in many areas that offer similar assistance.
I went directly to their website and I said, here's my situation. I have zero income and I have zero insurance and I need these meds. Well, I qualified.
This is the COPD podcast, hosted by me, Michaela Arneson. This show is part of the Health Unmuted audio library by Mission Based Media. To listen and learn more, visit healthunmuted.com and follow our show on your favorite podcast player. There are still many questions to answer about COPD, so please do keep listening.